guys, it's Jasmine Overstreet with Chatting with the Overstreets. Today we have special guest, Dr. Carolyn Davis. Dr. Carolyn Davis is a clinical psychologist and she is my cousin. I can't wait for you guys to hear what she has to talk about. She's going to speak on the topic of the negative stigmas and seeking therapy. Here's Dr. Davis.
Hey family, good afternoon. I am Dr. Carolyn Davis and I am a clinical psychologist. A lot of people want to know the difference between what's a psychiatrist, what's a psychologist, what's a counselor, what's the difference, what does it mean? So first and foremost, I am not a psychiatrist. A psychiatrist is an MD that prescribes medication and deals with psychological disorders and concerns. I am a therapist, a psychologist that deals with psychological concerns, mental health conditions, diagnoses, so on and so forth. But I do not prescribe medication. So I hope that helps clarify a little bit more about what I do. I've been in the field of mental health for almost 20 years now, which seems crazy. And I love what I do. I have operated in various realms in the field. I operate a private practice. I have also been employed in university settings and university counseling centers. I have an area of expertise in dealing with multicultural therapy, cultural concerns and training and competency, and also sports and performance. So you can see there's all sorts of ways that psychologists can operate. But today I just want to have some family talk about some issues that I don't think we spend enough time talking about in the Black community. And that's not only mental health concerns, but how do we seek help when we have mental health concerns? Psychology is an important part of how you function every day, right? Without a healthy mind, it's very difficult for anything else to be healthy as well. Healthy body, healthy relationships, healthy lifestyle, healthy workplace, so on and so forth. So as you know, this is an area we don't tend to give a lot of focus to. Right? Often we tell our folks if something is going on, pray about it, be strong, just get through it, take some rest, go to sleep, whatever those various crazy mythological healing tools we've heard in the past. And not that prayer is mythological, let me not say that. But I do want to say that God sends folks with all sorts of talents to deal with all sorts of things. The same way you have medical directors, that medical physicians that treat medical conditions, you have psychologists that work with folks who have mental health conditions. And if you had cancer or a broken leg or a broken arm, I wouldn't say pray about it or rest or just get through it. I tell you to go see the person most competent to support you and take care of your healing. And that is what I like to encourage folks when you think about mental health concerns, depression, anxiety, difficulty even with everyday challenges that seem a little bit more complicated than they should be. Take the time out to get help and support from those folks trained, competent, educated, and expertise to support you in whatever way is necessary. There's a lot happening right now in the world. With COVID-19, we've got a worldwide pandemic. We're also dealing with all sorts of social justice issues around, diversity and racism and inclusion in the world. And for those of us that are Black, that's not a new circumstance, but we are definitely dealing with things in a very unprecedented way. So it's bringing up a lot of things that, some of us have dealt with quietly. Some of us haven't dealt with well at all. It's creeping into our households. For some of us, it's creeping into our relationships, into our marriages, into our partnerships, into our families. And we are not necessarily coping or handling things in the best way that we possibly can. So I want to talk to you about how important therapy can be as a healing tool in circumstances like that, how important therapy can be to provide a safe space to say those things that you need to say out loud with somebody who's there to support you and to keep your information confidential, and to also have a safe space to offer some healing in places that have been traumatic for many of us, that have been difficult, that continue to be difficult, or maybe we just see things very differently than the people who we walk this world with, husbands, wives, partners, children, whatever that looks like. And we may need some support in working through that, getting on the same page, learning how to communicate, so on and so forth. So I hope this helps you understand just a little bit more about therapy, why it's important. When you go see a psychologist, you see somebody who looks like me. So I hope that's not scary. I hope that takes some of the unknown out of it. What does a therapist look like? What are they going to talk about? Why did I need to go to therapy? All of those things all wrapped up in one, I hope. If you can answer yes to any of that, to any questions about mental health concerns, if you can answer yes to struggling with anything happening in this world that just feels unmanageable by your own hand, if you can answer yes to any unresolved issues of trauma or pain or difficulty in the world we live in now, or even in one that you've worked through your entire life, that's a really good reason to go to therapy. If you're struggling with relationship issues, having problems at home that you can't seem to resolve on your own, that's a really good reason to go to therapy. So I hope this helps. I hope you know that Black people seek therapy all day, every day. I'm a Black clinician that not only treats, but I've sought it myself. So good luck. I hope you'll reach out when you need to, how you need to. Again, my name is Dr. Carolyn Davis. You can follow me at Fortitude Premier Services on Facebook, on Instagram, and at Fortitude Premier on Twitter. Stay safe.
Hey, how y'all doing? We want to give a special thanks to Dr. Carolyn, who's a clinical psychologist. We want to really thank her for all the insight and the different points that she shared with us. And we just want y'all to continue to support us and actually support her also. She gave her information, so just want to watch the video again, look at her information, and we really appreciate it. Have a good day. Bye.